Around 1.7 million Americans sustain a TBI every year. About 1.4 million Americans are treated for TBI and released from an emergency department annually. An estimated 5.4 million people in the US live with disabilities associated with a TBI. Without support, 75% of individuals in the US with a TBI lose their jobs within 90 days of return to work. The lifetime cost of each severe TBI survivor is estimated of more than $4 million. Car accidents, fall, and violence are the most common cause of the TBI. About 80% of all TBI cases are categorized as a mild TBI. Annually, about 60,000 individuals lost their lives because of a type of incidents that lead to TBI. Just in the US in 2014, 8,400,000 incidents were reported, that most of them involve young children 17 and younger. It's reported that 69 million individuals suffer from TBI each year globally. A study in 2019 showed between years 1995 and 2018, the homeless has experienced a high lifetime prevalence of traumatic brain injury. Approximately 50% of homeless persons experience a TBI. However, the same study claimed that the prevalence of moderate and severe traumatic brain injury among people experiencing homelessness could be 10 times higher than of the general population. But what is traumatic brain injury? CDC defines traumatic brain injury TBI as a disruption in the normal function of the brain that can be caused by bomb, blow, jolt to the head, or penetration injuries to the head. Everyone is at the risk of a TBI, but especially children and older adults. Going to the other studio where Samantha prepared an interview with a victim of a TBI. Thank you.
Hello, my name is Samantha and I am a reporter for Channel Half News. For our next segment, I have the privilege of interviewing a car accident survivor who had TBI a year and a half ago. Thank you for being here, Abe.
Thank you for having me.
So Abe, what would you say your main symptoms are today?
When I had my traumatic brain injury 1.5 years ago, my family told me that I lost consciousness for 4 hours. I had persistent headaches, loss of coordination, and sometimes my fingers and toes were numb. There were times where I was completely agitated for no reason, and sometimes I get blind spots in my vision. My memory was so impaired, and it took me so much longer to process my thoughts. I sometimes have some difficulty understanding speech and writing too.
Wow, that sounds like it's really been challenging for you. How has your TBI affected being able to engage in self-care?
When my fingers were numb, I could barely even hold a toothbrush to brush my teeth or a hairbrush to comb my hair. I couldn't even shower on my own because I couldn't even recognize the shampoo and conditioner bottles, and every time I tried to reach and grab for one of them, I kept missing each time. When I had to take my medications, my sister had to monitor when and how many times I took my pain meds because I would forget how many times I would even take them.
Thank you for sharing that with us. How did your TBI affect being able to get back to work and spend time with family and friends?
Before I had my TBI, I was a nurse. Because of the effects of my TBI, I'm still struggling with my memory and organizing my thoughts. And that's so important when becoming a nurse because I have to remember what time patients take their medications and to do documentation. I sometimes still have the numbness in my fingers and my coordination is still not 100% normal again, so I can't even insert IVs or draw blood anymore. One of the things that I struggled with was social isolation. I don't have friends anymore because I had so many mood swings and irritability, and I just don't want to talk to them anymore. The only times that I spoke to my family was if they came to take care of me, but even then I would just lock myself in my room and just ignore them.
Wow, that sounded like it was really challenging. What would you say is your main goal for yourself? In other words, what would you like to be able to do that you are currently unable to do because of your TBI?
I guess my main goal is becoming independent again and taking care of myself. I don't want to rely on others forever. My OT has been helping me become more independent and regain back the skills that I lost from my TBI. My OT helped me with my memory through making a schedule of my daily activities, and he also gave me a planner to remind me of my medical appointments. My OT also gave me some adaptive devices and tools to help me grip my toothbrush and utensils. He also gave me a home exercise program and performed some desensitization interventions for my hands to alleviate the numbness as well.
Thank you so much for sharing your story, Abe. You are an inspiration for us all. Back to you, Mehdi.
For our next segment, we have another report coming at you live in our studio to interviewing an occupational therapy specialist. Take it away, Abby, please.
Hi friends, please allow me to introduce Samuel. We are going to ask him some juicy questions about TBI. Hi Samuel.
Hello, Abby. It's great to be here.
It's great having you. So Dr. Leonard, can you please tell us what the prognosis is for individuals with TBI?
That was a great question, Abby. The typical prognosis for individuals with TBIs varies depending on the severity. Patients with a mild injury tend to do well. They may experience headaches, dizziness, or irritability, but in most cases, these gradually improve. For those with moderate injuries, about 60% will make a positive recovery, 25% will be left with a moderate degree of disability, and 15% will have a more severe disability. For those with severe injuries, only 25 to 30% will recover without a disability.
Wow. Thank you so much for that information, Dr. Leonard. Next question. Can you please explain a general overview of what kind of OT interventions or approaches that would be helpful for individuals with TBI?
Absolutely. There are many different interventions that an OT could do with someone who had a TBI. The type of intervention depends on the severity, type, traumatic or non-traumatic, and location of the injury. I will give a couple of examples. An OT could use splinting, casting, patient caregiver education, wheelchair positioning, and or other DME and adaptive equipment assistance. An OT could also do home safety evaluations, community reintegration, behavioral management, self-feeding, and perception. You can also not forget about addressing mental health with these clients, as such a big change can cause depression, anxiety, and loneliness. A lot of mental health interventions for individuals that have TBIs include rebuilding desired occupational and social roles. The OT might work also on self-control, self-expression, and time management through group therapy. Overall, interventions should be individualized and focus on functional outcomes that are meaningful to the client.
Thank you very much for that. So Dr. Leonard, what type of OT assessments can be used with this population?
There are many different assessment tools OTs can use for clients that have a TBI. The first one would be the Glasgow Coma Scale. This scale is typically used to assess levels of consciousness after a TBI. This can be used to quantify the severity of the injury and predict outcomes. The three behavioral areas assessed are motor response, verbal response, and eye opening. Another one that could be used would be the Graded Wolf Motor Function Test. This assessment is used to measure functional gains after a TBI. One can make each task easier or more challenging, so it is a great graded assessment. This is mostly used for clients who have a varying degree of motor recovery. Last, an assessment an OT could use would be the Canadian Occupational Performance Measure, or the COPM, which can assess clients with TBIs and their self-identified goals related to daily tasks.
Thank you very much for that. So for my last question, Dr. Leonard, what are the most desired outcomes for people with TBI?
Simply put, the most desired outcome is helping clients be able to participate in the daily occupations that are most important to them through remediation, adaptation, or promotion.
Thank you so much, Dr. Leonard, for sharing your knowledge of TBIs in the OT field. Back to you, Mehdi.
Thank you for watching Channel Half TUNews. I am Mehdi and presented this news with Abby and Samantha. Thank you.